Hello, everyone. Thank you for joining us today for another episode of A Girl Like Me Live. I am so excited to be here with Robin for, I feel like this is my first conversation that I've had with you virtually, but I love our conversations that we're able to have outside of lives. Um, uh, Today is our episode 41. I mean 42, and I can't believe we're there. But the title of this one is Managing and Connecting Around Other Health Conditions, What to Learn from HIV. And just a little bit about what this episode will be about today is talking about how we can benefit from understanding the relationship between HIV and co-occurring conditions. Robin and I both come with lived experience outside of HIV, and I can't wait to get into that. But before we do, I would like you, Robin, can you just introduce yourself to the audience? Who are you? Where are you from? And so glad you're here.
Okay. Hey y'all, how y'all doing? My name is Robin Barkins. I'm from New Orleans, Louisiana, and I have been living with HIV for 26 years.
That's so long. And you're like a community advisory board member for the Well Project, which can't believe it felt like you've been so close for so long. So I'm glad that that's official. And thank you for joining us today. I know you got a lot going on, so I really appreciate you taking the time.
I'm actually giving y'all my therapy time. I'm supposed to be with my therapist, but we'll figure it out.
Oh, well, thank you. Thank you. There goes Maria. Robin, I love you. You already got fans in the comments.
Huh?
I said you already got fans in the comments. That was Maria. She said, Robin, I love you.
I love you, girl.
So we're just gonna dive straight into the conversation. So like as women with HIV as we age, I know I've been living with HIV. I think this is my 18th year. I'm getting to that point where it's I think, and I heard you say 26 years.
Mhm.
All right, so we getting up there, like these grown grown diagnoses. So like what have you noticed like from the community or even things that you've experienced yourself like as you age? Is HIV impacting any of that?
Girl, my kneecap. I be I be having knee pain. I experience knee pain, little lower back pain, and some back pains and stuff. And I guess since I've been older, my posture has changed. I have a lot of different things like with back posture, my knee, things like that. Some little arthritis here and there, but I mean, other than that, I mean, I've been good. As far as any type of like pain wise, is like just navigating, like living with a diagnosis and how to stay well. I I try to stay. I feel like I have this motto: if I'm not mentally well, I'm not my whole self ain't well. So I try to really be consistent with my therapy because I feel like if my therapy isn't on track, consistent, and stabilized, I'm not. And that could look like that could look like all different types of things for me, non-adherence, not seeing a medical provider, not talking to my support system, isolation, not doing the things that I'm supposed to do for myself. So I just try to stay connected with family and friends, and if I have different little struggles, I reach out, talk to my therapist about it, and just try to stay connected. But like I said, the only other ailments as I age is just basically mostly, like my knees, little arthritis here and there, you know.
Or this, I mean, I'm sorry that you're going through the arthritis and stuff, but that sounds like a positive experience so far. Like if you complain about your kneecaps, I hear other people like, you know, whether it's a heart disease or it's a diabetes such as myself or high cholesterol. That's even they was starting to talk about bringing in the the cholesterol test. You get tested for your cholesterol? Like that's
Yes,
something
I,
that they
I
do.
get a lipid panel. So every time I get my labs done, I do get a cholesterol test because my heart attack was caused from high cholesterol and things like that, from having high cholesterol. And so my doctor really makes sure he stays on top of that. And as far as my heart disease, like I tell people all the time, I have 99 problems, HIV in one, and I feel like that's the same thing with my heart disease. But I have to be mindful that I do have these comorbidities because I have to be mindful of exercise, dieting, and certain things like that. And especially smoking and just trying to just do things to stay well. So I mean, like I wouldn't say my heart disease. Yeah, I just have to be mindful. It's just like you have to create a regimen that works for you and yourself. It's not just a one size fit all. You have to do what works for you and build off that.
Mhm. You said like a whole mouthful when you was talking about your, like mental health, and if that's not together, then how many other things can like essentially fall apart? Like if my mental health is not together, I might not feel like going to go take that treatment, or I might not feel like what's a heart doctor appointment when I can't get up out the bed? I don't feel like to go get these labs done. So that mental health is so serious. And I know that you're going to do it, but I hate that you missed your appointment to join us. And thank you for joining
So
us.
I could text my therapist. She 3 hours behind me anyway. I could text her and we could have a phone conversation. So
Okay.
that's really not a big deal. I try my best not to miss my therapy appointment, and if I do, me and my therapist have a good enough relationship to where we can follow back up.
I love that. I love that. And, therapy is one of those sore spots sometimes in our community. Like, why you gotta go tell somebody else your business or something? But I have found it to be very resourceful. Like, it's helped me a lot.
For me, I feel like I'm real clear about therapy because I know what happens when I'm not well. When I'm not well, nobody is well, and that could look like different things. I can go get violent, anything. I can just blow up, not take care of myself, anything. So I have to be real clear that I need mental professional help because I can snap. And if I'm not stabilized, and not just saying with medication, because I don't take mental health meds, but I know what helps to stabilize me, and I know the tools that I need to keep me stable. And without that, it might not look good for you.
Hmm. Hmm. I see that our fact sheet had got put up a little moment ago about caring for your whole self, and I think that's where like the mark is missed sometimes is that yes we're women and we're living with HIV, but I need for you to see all of what that means. It's not just HIV. Like really at the end of the day, that HIV is far at the back of my mind. So if it wasn't for the work, HIV would not even come out of my mouth most days. So I need for you to see all of that. And it is my mental health, that is my sexual health, that's all of that. And I see Maria's comment about I'm bipolar one, and yes, a lot of stigma with it. I don't give a damn what others think. I know that's right, Maria. There's so much stigma. That stigma is crazy because I know what it feels like in HIV and looks like, but there is stigma when it comes to mental health. And why is that?
Because I could only speak from my personal experience being a black woman from a black community. We were taught, especially being from the deep south, we were taught how not to, like if you see a medical professional or anything, you crazy. Like it was just highly stigmatized, in our community because, like for me, like I remember back in the day, they would be like, "Oh, she crazy. They about to take her to the third floor." So the third floor mean where all the crazy patients went. And eventually, when I got older, I went to mental hospitals and things like that. But I just felt like that was because denial, not wanting to help, not coming from an environment where you were told you were crazy when you felt some type of way mentally. You had to learn how to suppress your feelings. You had to learn how to do this. So when I was diagnosed with HIV, I had to suppress my feelings, but not only suppress my feelings, I had to cover up this debt too. So now I'm trying to cover up a debt, trying to cover up secrets, and then it's making me sick because they say you as sick as your secrets, right? So when I fully surrendered my life and accepted myself, and I knew the tools that I needed, and I know mental health was one of the tools that I need for a long time to help me, because sometimes even today I suffer with mental health and I struggle. So I just feel like seeing a professional and telling them your stuff is life saving, because we bottle this stuff up because of the type of communities and the environments we come from, because we always get criticized as being crazy, and then you really lose your mind. You really, what I call, bust a nutty. You know, you really be emotionally dysregulated and you just be blowing up anywhere. And for me, when that happens, when I'm unstable, I hear voices, all kind of stuff, you know. And then if I use on top of that, I got drug induced psychosis, girl, and I am not well. So I have to stay connected because I'm real clear about who I am. And if I'm not well or treated, it ain't gonna look good for you. So, you know, it's just about knowing yourself, knowing what you need, and create a plan for yourself and with another professional on how to keep you stable and well. So I think that's the main thing.
And you were saying exactly what Maria had written
Well, I
about.
can't really comment, so I'm
It's
just,
okay. I got you. I got you. Maria was saying that sometimes folks with mental health utilize substances to take off the edge, and this accelerates your systems. Is very complicated. So, yes, I thank you both for raising that point.
having to use drugs, though, it causes a drug induced psychosis. So using the drugs don't necessarily always help,
Hmm.
because it causes other things. So that's why I say just talking to a mental health professional, staying well, and staying connected with a group, a network of people that know they have, you know, like other issues and need mental health support or emotional support. And you be around those people, because when you around people who think they just well and have it all together, that's just an accident waiting to happen. So I just think you need to be around people that talk, you know, living a truth and real about their struggles, you know, and they can't do it alone. And that's how you're able to overcome some things, because we can't do it alone. It's like, even me, I could be this hardcore gangster thug, don't cry. I can't do it alone, yo. I really can't. So I have a whole crew behind me that helps me stay well, you know, and yeah.
Hmm. Oh, you just keep saying so many things, that support system, like when managing, HIV, and so the and that we at right now is the mental health piece of it. Um, that support group definitely helps, and around like-minded folks or folks that think positively different. I don't want nobody to take me backwards, but continue to stay well so that I can take care of myself. Because, like you said, if I'm not well, so many other things could fall apart. So many things. And I want to continue to, stay where I'm at. The community support part is so crucial. I love the comments that are coming down. The resources that are being shared from the comments. Thank you so much for that support, y'all. Um, so we the next thought of like reducing. I heard you talk about a little bit of that heart disease risk, and I know that comes up. We lost Robin for a moment. I wanted to get into it a little bit with her about the heart disease. So we'll just there she goes. She all right? Hold on. I'm gonna get you back going. Where's I? There you go. There you
Okay. So
go.
you said something about heart disease risk.
Yes, yes,
Mm.
yes. So talking about that because I know you and another advocate, Masanya, our friend, she talks about, having a heart attack fairly young. When I heard both of your stories, it's like, dang, I didn't think we were at the age where folks start having heart attacks and then they're just coming out the middle of nowhere and stuff. And so I want to hear a little bit more of like the work that you've done in advocacy. Um, and has anything from HIV advocacy taught you how to advocate for yourself in that space?
Well, yes. So the work from advocating for HIV helped me to advocate for myself in that space because of the fact that SCAD is an unknown. It's really not known. Is SCAD, it stands for spontaneous coronary artery dissection. That's the type of heart attack that I had, and is still like I said, Stanford University has the best SCAD clinic in the country. So, I have been for since I had the heart attack. We have been trying to get me into Stanford University into their SCAD clinic, and also I also have been advocating with UCLA AIDS research and also other individuals about how can we start the conversation for women with HIV and what's the correlation between women with HIV and SCAD. And what I do know is SCAD and HIV have chronic inflammation, and that's what SCAD causes. SCAD causes you could have a SCAD heart attack from having chronic inflammation. So I would just want to see the relationship. So I keep bringing that up in different research spaces so we can have the conversation and also to pique their interest. So right now, I'm leaning closer on Stanford, like researchers listening into the HIV space, but I think we need to bring more heart and research doctors, like more into cardiology. I think we need to have like a holistic network of researchers. Like, you know how like when you age with HIV, then you start getting heart disease conditions, lung conditions, and things like that. I think we need to have a research lab of like a cardiologist, a lung doctor, things like that, so we can know, like, as we age and progress with HIV, what does that look like, and how do that put us more at risk for all these other comorbidities than others? Or how can we stop that or change the weather? I don't know. But that's where I'm at. I can go down a whole research rabbit hole on what I think, we could be all day. But that's just a little bit about what I think about living with SCAD. And I think I probably just answer more to your question, but um, I don't think a lot of people know about SCAD though. I don't think a lot of people, I don't even think a lot of women know about SCAD, because I think SCAD affects more women than men. And I don't think a lot of people know about that, because a lot of my SCAD cardiologist, he said I'm his youngest SCAD patient, and it's all of us are women. I'm his youngest patient. So, I'm just, yeah. So
Mhm.
what was your other question?
No, it's cool because we getting comments, and I love that rabbit hole you was getting into. Kim said we need to leave the HIV space and spread out to other sectors of health. Absolutely agree.
Yeah, I
And then,
think, okay,
go
go
ahead.
ahead.
No, go ahead.
Yeah, that's why I said I just think it's just important to have a whole healthcare network. Like I said, as we age, because as you age, it's heart problems. Some people may have some type of form of arthritis. Like I know in some parts of my family, osteoarthritis, rheumatoid arthritis, and things like that runs in my family. So I just feel like, what does that look like for us as we age? So that's why I think we should have more of these conversations and bring, because a lot of researchers and cardiologists don't really know too much about HIV and AIDS and what that looks like. They don't know about undetectable. So sometimes when you meet these other professionals, you have to have an educational session with them. And you have to let them know who you are and what you have so they can know how to treat you. So that's how you advocate for yourself too when you're dealing with these other medical professionals that's not in the HIV realm that work with us often. So that's another thing of advocacy in healthcare.
Mhm, mhm. The comment that just came up: the chronic inflammation also can contribute to getting diagnosed with rare skin diseases and rare GYN challenges. Thanks for this information session.
Yes, I agree, because for me, like my chin, I had real skin problems over the years. Like after, during the pandemic, uh, during the pandemic, I had fibroids and I had to get a myomectomy. And first time ever having surgery, I had to get two myomectomies for my fibroids. Once I had the myomectomies, I started getting real bad skin problems. Even started getting shingles. I never even had shingles. Started getting shingles, all different types of skin like patches and things. So I had to see the dermatologist. So yes, that's true. You do get skin you do have skin problems because I did experience that. I've just shaken back in the skin department. In my face I had patches. So I do know how that can mess with your skin as well.
Mm. Oh my gosh. So like while we there, have you has been navigating those other doctors and stuff? Has it been easy? Like have do you have to go in there and teach them about HIV, or is HIV not a thing? Like they
Sometimes, but I tell them what I want and what I need, and they basically listen because I go in there with confidence, knowing what I want, knowing what I need. And sometimes it's not just about HIV. I may have, like for me, like back in the day, I used to get perms a lot. And one time, my grandma, I had told her I scratched my, I told her I scratched my hair after the lady put the perm in my head and she made the perm sick. So I ended up getting a mange. So my scalp had been messed up for some years. I was a kid, so I always went back and forth to the dermatologist. But again, the skin issues and the scalp issues. Recently, I went to the doctor and I told him what I needed. I told him my history with perms, told him this is what I needed. Sometimes you have to go in there, you have to tell him what you need. Baby, I need this. I need that. I don't want to hear nothing else. Write the script and give it to me. You know what I'm saying? Sometimes you have to be your own doctor and know what you want, and and it's your resource to write the prescription because you already know what you need. You know what I'm saying? So I'm
Mhm.
like, I need some medicated shampoo. I need some cream for these patches, you
Mhm.
know. And they be like, yeah, you do. I can see. They write the prescription, come back in a month, let's check it again, and here we go again. You know, so you're your best advocate because you know what you want. You live with yourself every day. You know what I'm saying? You have to look at yourself, you have to check yourself so you know what you need. And you could best tell your doctor what you need. And if they don't give you what you need, baby, you can always call your insurance and change your doctor. Period. You ain't got to stay nowhere you don't want to stay. If they ain't doing right by you, call your insurance and change your medical provider because you don't have to stay nowhere where you feel like your care is not top notch.
Yeah. Ashley talking about she need patches, cream for her patches too, girl.
Right?
And Kim
Call the
wrote,
dermatologist, girl.
yeah, that's what I got a dermatologist appointment. This is my first time ever going to a dermatologist. I ain't never been no skin doctor
I
before,
love
but
my dermatologist, baby.
my,
I have a whole medical team. Everybody know. I tell everybody what I need. They don't need. I tell them what I need. You know, when you build a relationship with your medical team, because they tell you you're in the driver's seat of your care. You the driver. Your doctor and everybody else, your doctor, your cardiologist, your hematologist, your dermatologist. I got all them tologists too, just so you know.
mm-hmm, mm-hmm.
They're all my passengers. I'm the driver. And I get to tell them what I need from them as they in my car. You know what I'm saying? They get to tell me what they need to, how, you know, how they can support me. But you have to always remember, if you help, you in the driver's seat. Remember that.
I love that. I love that, and I love that visual. Kim's comment about I'm pretty sure I can't pronounce that word. I know the acronym is HS. I'm pretty sure my HS is connected to my HIV, but what do I know? So hydradenitis suppurativa.
Well, that sounds like some skin stuff. That sounds like some skin stuff.
Yeah, there is some skin stuff. All I heard sativa. My bad. That's why I started laughing. But it
It's
definitely
skin
is.
stuff. It's skin stuff. Sativa is good for the skin. Anything
Okay.
with sativa is good for the skin, chronic inflammation.
Okay. Okay.
Mhm.
And saying that that could possibly be related. So then, we hear these things and we talk to communities like, dang, well, you too. And sometimes I didn't always have access to that community. So I'm going through things over here and I'm like, maybe this is just my own experience. Maybe nobody else is going through it. Like, no, you too. The skin stuff, just seeing the early onset when the diabetes came into my life. That was like 2024. That for me, it felt like it came out the middle of nowhere. Now, could it been? I contributed to it absolutely, but to me, because I've been in care and I've been being seen by folks, I felt like I was healthy and I was doing right. Because if I wasn't, then somebody would have told me, and that wasn't actually the case. I found out when I got in the emergency room and I had to go to the ICU that this diabetes was bad. So taking control over that, and I'm thinking like if I had been in the driver's seat of my health and not entrusting my health care into other individuals and use something like the resource that the Well Project we've created about like different screening tests that you might want to get done around a certain age, then I might have been in there asking, what does my A1C look like? Do I look like how's it going? I know that I have a family history of it, but like how am I doing? And I wasn't doing that. I don't know. Sometimes I just be wanting to be taken care of because it's so heavy. But ain't
Baby,
nobody.
you live with a pre-existing condition. You don't have the luxury. You're gonna always be in the driver's seat, whether you want to feel like a lady and be taken care of. You still gotta be in the driver's seat, baby. Period. If not, if you try to let somebody else drive for you, you will miss the mark. No matter how good you want to feel, you gonna feel good driving. And every doctor do what you need them to do. Cause like for me, when I go to the doctor, I tell my doctors what I need. Like I'm gonna give you an example. Like it was something that I needed tested. Oh, my dad passed away of lung cancer, and I know I smoke. I have a history of smoking, and my uncle also passed away of lung cancer. So I had got some tests done, like the CT scan on my lungs, and you tell them why you want these tests. Because my father, I'm highly susceptible because my father, diabetes, my mother, father, and grandmother had it. So I bring them this whole long family tree. And one of the things that you people need to really know that's important, knowing your family health history. Because if you don't know your family health history, you ain't gonna really know how to advocate for yourself living with HIV. Because when we have a health history of a lot of pre-existing conditions, we are living with HIV, we are more susceptible to those living pre-existing conditions. So that's why every blood test, every lab, every time I tell them check for this. If I see something on a commercial, I say, baby, check for that. I might got it. I tell them check for anything. Because I'm paranoid. My doctor, he don't question me because he know how I am. I'm like, check it. And sometimes it come back with a concern, so you have to know your family health history. You have to know where you come from in order to know where you're going. And don't just think, oh, I'm living with this, so what? No, you're your best advocate. Advocate for yourself. Speak up for yourself. If a doctor, any type of medical staff make you feel some type of way and don't make you feel right, you get to it's your social worker. If you have a social worker on the team to help mediate, to help you walk through this process. If you still want to keep your medical team, because sometimes you still want to keep, you may not have no other access, but um, yeah, advocate for the best care you can for yourself, and that's it in all areas. Tell them because some doctors don't test for everything. Tell them to test for um lung cancer if you know your family, your dad or somebody close, like your close relative, like especially your parents or a sibling. Like my sister, she passed in 24. She had an AIDS related cancer. I still get them to check me for that AIDS related cancer my sister passed from. Because I have to be real clear, that I'm vulnerable. And you gotta check all stops. Your insurance is gonna pay for it.
I love that because and somebody else from the Well Project agreed too. Said that is really important and should be part of a checklist going into screenings. Yes, like the family history piece of it. I My dad's side is Jamaican, so everybody there. I don't know a lot of my family from that side. I don't know anything. So the only person I'm going off of is my dad. Um,
And he probably don't know.
he don't know. He don't know. And so then I do have more access on my mama's side, and it already don't look the best over here. So it's all this stuff that I came into it with, and with the diagnosis from when I was 20, and then lifestyle choices that I've made since then. I know. And okay, I'm gonna be real open and vulnerable and honest. Like, that's scary. So sometimes I can kind of understand why folks don't go get an HIV test. If I would have walked into that test that day knowing that it was going to be positive, I don't know if I would. Like, I don't know. And same type of anxieties and fears come up when you start talking about them other screenings. Like, dang, well, it might be and is some anxiety, and it makes me nervous. And I feel like that's where a support system comes in. Child, I done been and everything turned out fine, or child, this is what to expect when you go in there, or it's not that bad. I got one friend that tries to convince me that I need to get that anal swab, to check for that. And I'm like, but that thing hurts. I don't want to do that. But oh, it's not that bad. Okay, I'm at least think about it.
Yeah. I mean, if you got some homegirls like that, some of them sit in the waiting room for you while you go take care of your business. I didn't have my friends that took me to doctor's appointments, biopsies, and things like that when I was afraid and sat right there in the waiting room to show me, like, girl, we got this. We together. We gonna do this. And sometimes just having that support system and that support network to show up for you when you can't really show up for yourself is important too. And I mean, I just had a biopsy recently before I moved back home to New Orleans, and I was scared because I'm like, Lord, I got HIV, not my little heart. I don't need nothing wrong with my breast now. I don't need nothing extra. Then they calling me back talking about we gotta do a biopsy, we gotta clip this and clip that. I was like, oh Lord, what I'm gonna do? Because I don't need nothing extra. My whole goal is I don't want nothing extra. Nothing. So we went in there, everything came back good, but it was just that fear of for me, it's like that fear. Dang, I don't want nothing extra. Dang. Like, so it's like I'm already trying to navigate all these other pre-existing conditions, and I don't need nothing extra to fall on my lap at the moment. I'm looking for my asthma pump because I need my asthma pump too. I got to keep that near.
Another co-occurring.
Another Now, man, I didn't move to another back home to my home state from California, and the weather and the environment is different since I've been out there. I barely had to use my pump, so now I'm back in the south. I have my pump is my baby, my little baby now. I call her my little baby because me and her have to stick together every day.
Look, Ashley said, I know we only 35 minutes into this live, but we need to have Robin back again.
Oh, really? I can't see, girl.
Yes, I got you.
Oh,
It's Ashley. Yeah, I was gonna tell you, got the comments jumping. I saw another comment from T that came up a moment ago. I can't scroll it to get to it, but talking about importance, I think, of research. Yes, it's imperative that more research be done on those of us that have comorbidity challenges, one after another, two, and rare ones as well. I have three in the last year. I have to go back to my classroom with students, but I pray this will be recorded and I will. Okay, she had to get off.
we got you.
T. Thank you, T. Yeah. And then it just seemed like stuff sometimes come out the middle of nowhere. And I heard you, talking about your father. I'm currently caretaking for my father and watching him age and his health not be what we're used to his health being. And all of those follow-up appointments and then the kids. And like it is so much. And having a tribe that understands that, and I'm grateful for long-term survivors like Maria, who she always talks about the beginning of the epidemic, and we didn't have all of these treatment options. It wasn't, I'm sure that it was not as much information because they still not doing it. Researching women when it comes to certain things. When we're just like, it seems like we're at the bottom of the totem pole, but I'm grateful that we are moving and at least being able to have these conversations. So, like you said, you with the heart stuff, I'm going to keep bringing it up till somebody pay attention. I'm going to keep talking about it till it actually gets the attention that it deserves. We really appreciate those types of advocates and people that are willing to put themselves out forefront like that. Okay, I also saw a comment from Krista earlier. I think I got it. It's about do you see any differences in the response from providers or researchers in your advocacy around heart disease versus HIV? So in the response from it.
Do I think anything in a response
Yeah.
from? Excuse me, y'all.
Uh-oh.
One second.
Yes. Yeah, that's a good question. I could say, Robert, why you okay. Let me make sure you are right.
Guys, the asthma. Okay, so say that last part one more time.
So, do you see any differences in the response from providers or researchers in your advocacy around heart disease
Not really.
versus HIV? Okay.
Not really, because it's still new.
Hmm.
It's new. Like they talk about, they'll talk about heart disease in the conversation, but they're not gonna talk about what kind. But I feel like for me, because when I had the scare heart attack, I went down a scared rabbit hole. Learning about SCAD. That's how I learned about Stanford University had this best SCAD clinic because I did a lot of extensive research and it's not talked about. SCAD has still been yet to be really discovered on why these heart attacks happen, but they do know it has a relationship with chronic inflammation.
And then I keep hearing inflammation come up when they be talking about HIV. I
So the relationship is there, but we need people like me to be accepted in the study.
Mhm. And how would you even go about like trying to get
So
into
my
a
doctor
study?
tried to put me into the SCAD study with Stanford. I was denied. So that's all I think to go about. We'll talk about that offline. But I've been trying to get, that's why I said I've been advocating to get in the SCAD study since I had the SCAD heart attack because Stanford has the best SCAD clinic in the world. Telling you, my doctor tried to get me into that. My SCAD doctor, not my infectious disease doctor, my heart doctor.
Oh wow. Wow.
So it's just, it's just that and that part, that's my fight. Trying to get in the SCAD clinic and also being a part of the other research cabs and bringing highlighting that and keep saying, hey, what about women with SCAD, HIV? It get brushed under the table, but I hope I still be here. I hope they really take it in consideration in my lifetime while I'm still alive to really take in consideration about SCAD, like women with SCAD, because I don't think the other person had a SCAD heart attack, but it was not myself, but it's a lot of people living with HIV. I could count on one hand that had a heart attack. So I want to know how is all related. How is it all related? And I think that's the part that we fail to talk about, how HIV and heart disease, what does that look like? And how that affects, and also HIV and the lung health. Because I remember when I first came around these rooms, I started when I was diagnosed with HIV and started getting treatment, I started having upper respiratory infections every year, every winter. So and then that's when I was diagnosed with asthma and all this other stuff. So it's like I feel like when we have HIV, it should all automatically be other studies about what happens to the lungs, the heart, and what all happens over time. and how does it progress. I don't think that those conversations are had enough because I feel like in the beginning of HIV they didn't think that far, but now baby we almost 40 years in the game. Y'all got to start thinking faster. Cause we got asthma, heart disease, lung cancer, HIV, ovarian cancer, uh,
Breast.
cancer. We got all these cancers on top of having HIV, and we 40 something years in the game. So what are we doing? What are we doing? We can't just still be on the whole HIV wave because we developing more things than just HIV. So that leaves discussions for the other stuff. So that means we need to get some other type of specialists at the table.
Yeah, and that's what Krista talking about it in the comments. Like, have we?
Conversations on because baby, my HIV maybe wasn't just on the live. I was just joking. I need my little inhaler.
Lord, nah, what am I
No,
supposed
for
to do?
real, but no, it's serious. It's
Mhm.
really laying out questions like, what are we doing? When we talk about research and AIDS research and all this, because if you cure me from AIDS, baby, I still got heart disease. So what that's gonna look like? I'm still gonna have asthma. So do I really want the cure? So these are it's just like a lot of it's like a real deep. See, I go into the rabbit hole of thinking
I
like,
love it. Look, Ashley love it too. She said, "Say it again, Robin. Say it again."
for like, what are we doing? Where the money going? We need to bring some other people at the table to really have the conversation because we are aging with other pre-existing conditions. So
Do your
what?
specialists talk together? Like, does any?
Sometimes, but not all the time. I remember my heart doctor and my HIV doctor did, but not all the time. And that's another problem. You know what I'm saying? Like everybody, I'm big. Like I say, I'm in a driver's seat, but it's like I might have a specialist in Beverly Hills and my doctor in South Central. My lung doctor here, my neurologist in Lancaster. You see what I'm saying? So it's all spread it out because I want the best care. I go to who listen. I might be in South Central, but I'll go to Lancaster if you listen and you treat me good. I'll travel. So it's just like,
So, like, what the talking? Because I try to keep my doctors in the same system so that they could see my chart and everything. Or should they be doing like physical phone conversation?
they could see your mind chart. They could
Okay.
actually see your mind chart too to see what's going on. But if they have other questions, I think they should be in communication with your specialist.
Mhm.
But
Ashley
yeah.
said, "Send this to everybody, all the providers in the world. Just send them this video. That's
Mhm.
it." And I saw Olivia, so many key questions in the cure space, other health conditions, services, and tools that are for well-being that are tied to HIV, and it's related, but it's a whole nother lot. Yeah, like would I want would I take the cure if it was available tomorrow? Whole nother conversation.
I wouldn't. To me, I wouldn't. But I right now. Like I always tell them, baby, y'all do them first, and y'all come back to me once everybody then got what they need, and everybody walking, talking again, and doing whatever they need to do. However long that process is, you do them first, and then you come back and holler at me later, and then I might consider if I want to do it. But other than that, no, not me. I'm not racing for the kill like that. For me, that's for y'all. Y'all can do whatever y'all need to do, but not for me.
Oh my gosh. Okay. Killing me. Okay, this has been such a great live, y'all. Thank you so much for all of the comments. Thank you so much for the engagement, Robin. You have been wonderful. Um, I was I noticed that my providers they don't really talk. Like so if I had the endocrinologist for the diabetes and then I had the infectious disease folks and the primary care people, they wasn't doing it was like I was having to tell the same story when I went to each place and they share the same my chart or like why are you on this medication? They couldn't get my medication, the dosage of that right to save their lives.
Yeah.
I was just so confused. Then I was confused that like why am I HIV doctor over here, she took care of all my stuff. She was my primary care doctor. But now, because I'm over here, I got to have a different primary care doctor. It's so much to navigate to where the easy thing to do is just to focus and hone in on one of them. Just hone in on one of them. So I think, I mean, HIV is where I'm at right now. And the diabetes seems to be in a good space.
Mm.
But then long term, because I'm watching the effects of diabetes in my family long term. And that ain't really the way to go neither. I want to stay on top of that too so that I can continue to be well.
Can I suggest something? Just a suggestion. Because
Hmm.
I do have diabetes in my family too. So, and my mama have glaucoma. So what I do is I make sure I see an ophthalmologist because sometimes I experience a little blurry vision or something. See an ophthalmologist every year to make sure my eyes is good. I think you should. I think you. I'm not a professional, but I think you should consider it having diabetes and make sure you keep your eyes together, your eyes checked, and just different little things that you could do to. Because diabetes to me is worse than HIV. To me, that's just to me. That's my opinion.
Now,
And
when they had me taking that medicine, like I had to take insulin every time I ate and at night, I was like, yo, this is impacting my life way more than what HIV has impacted my life.
so
Taking
you have to take care of your vision and everything with diabetes. So I would try to get an ophthalmologist just to make sure your eye health as well because it does diabetes does kind of bother your eye health. So that's just a suggestion from me to you to like consider that and
I
put that in
had,
part
I
of your
had, I
put
had,
that in your car, your ophthalmologist in your car.
because they like suggest certain tests when you get a diagnosis, I guess, in my chart. And so that was one of them things I had to do was to get in to see an eye doctor, which seemed to be okay. But she said next time I might need to look. When they were saying like, the importance of us going to the dentist and everything because HIV and the medication or whatever can cause bone loss and stuff. So what? In your teeth, there's bones. Oh
That's why we need holistic care. That's why you have all these doctors.
my.
That's dentists, you have everything. That's why I said you're in the driver's seat of your care. And even though all your doctors may not communicate, you are the communicator. You could you the linkage between all them knowing what's going on with you. Because whether they ain't gonna go through that mind chart and look at that all the time. So sometimes you may have to bring them a snapshot on, hey, this what this look like. The doctor took my labs for this, but they think you should look at it because you the specialist for this. You see what I'm saying? And that's how you hold them accountable and keep and stay well because you got they work for you, not the other way around. So
Whew, I think this has been such a phenomenal conversation. I know that we have a survey link somewhere out there. I'm going to ask that when that gets posted into the comments that you all just take a moment and complete that. Let us know if you have any ideas or thoughts for any upcoming episodes. Let us know how we did on today's episode. It's always so great to sit with different people for the community because, Robin, you have thoroughly kept me entertained today. I want to just hear you keep talking, my son. So let's see. Or I'm going, I don't know. I'm trying to see where I'm going to go next. The importance like this doctor space, and I really like where you said you being the linkage. So I don't know. I think it would be helpful for me like if I just kept notes, so from this doctor to this doctor, so I don't have to always remember everything when I go into. I'm not going to always remember that, that this day I had this symptom or this day I felt this way. So I think writing down stuff sometimes could be helpful for me. I think I've never asked my doctors if they speak to each other. That
they
might be
probably don't because they probably not even in the same. Yeah, they probably don't.
maybe that could be somewhere that I could start though. Maria said that many times we teach our providers. Many of us have lived longer with HIV than they have been specialists.
Yeah. Girl, you become their teacher. You tell them how you want to be treated. Then you be to sent them to a training. and all kind of information. You help them with stuff because you develop that routine to where you advocate for yourself, and also you develop a thing probably where you see a potential in a doctor. You be like, I think you need to get some more education, or something like that. So it happens like that. But yeah, sometimes like I said, you on a driver's seat, and that looks different from everybody. And being in the driver's seat is telling somebody how to treat you, and that's with everything. Sometimes you gotta tell a doctor how to treat you. Like, look, like I had to tell a doctor, he called me a hypochondriac. And I went off on him. You don't take as long. You better be lucky. I'm taking care of myself.
Mm-hmm.
Worried about myself.
Mm-hmm.
So you have to speak up for yourself. You're your own best advocate. And don't let nobody bully you in this healthcare space and tell you don't know nothing. You overreacting. You reading too much. Don't never let nobody tell
That
you
sounds crazy.
nothing. You know what I'm saying? You your best advocate. I was diagnosed one day, one night. They tried to tell me I ain't have PCOS. I have hirsutism, and I suffered with hirsutism since I was in middle school. Where I have facial hair, I have chest hair, long sideburns, and all that stuff like that. And they tried to tell me, the endocrinologist tried to tell me that nothing wasn't wrong with me. Like I didn't have PCOS or anything. Well, I was misdiagnosed with PCOS. They ended up misdiagnosing me with PCOS. I do have hirsutism, but the hirsutism was just hereditary because I eventually found a doctor that looked like me. So the hirsutism was hereditary. My mom had hirsutism, which is my great great grandma. She had hirsutism, which I developed the hirsutism from my grandma, but the fibroids and the cyst is things that I developed from like my mama had. After my mama had me at 25, at 27, she had a partial hysterectomy. And, so I just put those things into consideration when it comes down to my health. Like I have fibroids now. I never was able to get pregnant or, conceive, but I also was misdiagnosed with PCOS when it was really, really fibroids. So you
Oh,
could get, you see what I'm saying?
oh goodness. That was a lot, but I really appreciate how on top of your health you've been. Like,
I have to be, girl, because being an ex-drug user and coming from the streets and having a history of being a street-based sex worker and all those stuff, medical professionals tend to treat you different, and you have to let them know, hey, baby, don't play with me. I'm here. I ain't out. I'm here for a reason. You gonna respect me. I'm here for my care, and you gonna respect that, and you gonna give me care. Because if sometimes when you go into spaces and they know that you have a background like the way I do, you see
uh-huh.
some discrimination. You face a lot of places where you don't feel like you belong. So I step into the place and I make that clear. I don't care nothing about my past. You here to treat me, and that's what it's gonna be. I'll find another professional. So it's just about my approach, and I demand respect in the medical space. I don't play that. So in order to get respect, you have to give it. But I give respect, but I also give it in a place where I demand it back. No matter what
Have
that.
you always been like that, or that was something you had
Always
to?
been like that. I ain't had to learn it. I always been like that because it was always me. Like when I first started taking my HIV meds, I was in a whole nother state. I had moved from New Orleans when I was 21, and I was just kicking heroin and trying to learn how to live life on life terms. I ain't have no support. It was me. So I had to really be my best advocate, my muscle. I had to do everything for myself. But I've always been like that. I never took no shorts from nobody. That's why I never took shorts.
Oh, this is so inspiring and empowering. I just feel like I can go drive this car of mine to all these different specialists. You keep trying to add folks to the car, talking about ophthalmologists, dermatologists.
Tell me, because
Every
they take care of different things.
I want to read one of Nina's comments because I see so many of them keep coming up. So she says, you should never be treated less than anyone else. Past is in the past, but stand up for yourself. Maria's calling you a warrior. Uh, what else? I saw a few other ones come up. Yes, Robin. Yes to all of this. I love for like demanding the respect, giving the respect, driving this car. If the person ain't working out in the car, you could get out of
Put
my
'em
car.
out, baby. Put them out.
And you gave me a resource. Like even I know that when we like pick our doctors, you can call your health insurance and they'll give you like other providers. But I've never thought to use that. Like, cause I think if I was still living down south, like, okay, this provider isn't working out. Where else could I go? Oh, I could call my insurance company and ask them where else I could go. Like that, so simple, but I had never considered.
And if they don't work out, you keep on calling, or you go, it's word of mouth, or your home girl may have a good doctor that they can refer you to, they specialist, and then that's how it is. Sometimes it's all about word of mouth, but don't never play yourself with your medical care. Don't never make nobody feel you less than you supposed to feel. And don't never feel like you have to stay somewhere because your insurance paying for it. No, baby. If you don't feel like you getting the care you need, you better get up and you better go. Just like with any relationship, if love ain't being served, you better go. So that's just with your health care. If love ain't being served and patient care ain't being served, you better bounce.
I know that's right. Well, Robin, I think that's a great place to end it. Like that was a mic drop. I don't know if you have anything else that you want to send the folks out into the world with, but this has been a pleasure. I thank you. Like we gotta have you back again. I can't wait. You want to go down the research rabbit hole? What's the next thing?
Girl, you ain't gonna have me stuck on this camera. Going down the rabbit hole of research. But
It's
I'm thankful for being here. I hope what I said kind of helps somebody. I don't really do lives a lot. I don't really talk. I won't say I don't talk a lot. I'm present, but I don't really do lives a lot. CC called me by surprise. I'm like, huh? But all right, I made it happen because it was CC. But yeah, like you can always inbox me if you have any questions or any concerns. You can follow me at R Barkins one on Instagram or Robin Barkins on Facebook. You can also follow my nonprofit page Trust Heal Thrive on Instagram. um yeah, so reach out if you feel like you stuck somewhere, you need to be connected, or you need some advice. You may be struggling with addiction or anything, you may need a meeting in your city, anything, just holler at me. I'm easy accessible, you know what I'm saying? So just get at me if you need some support.
oh, thank you. Thank you everyone for joining, for being here. We'll see you next month for our next episode of A Girl Like Me Live. Thank you.
All right, bye.